My name is Young. In October of 2022, I started to develop pain in my lower back and down my left leg. Then in April of 2023, I had an MRI which revealed 3 herniated discs. The neurosurgeon I got referred to told me I was not a candidate for surgery, even though my pain was really unbearable. My question is, what else can I do to alleviate my back pain, as medications and injections do not seem like a long-term solution?
Welcome back. Lower back pain, degenerative bone disease, plantar fasciitis, arthritis, those are just some of the pains we may experience in our lifetime. So what can we do, first of all, to prevent it, and what are some of the long-term options, as we just heard?
So I can completely relate. I've had a herniated disc in my back. It is excruciatingly painful. What my experience was through the healthcare system and what the research shows in preventing it is maintaining a strong core, right? You have to make sure that your body is able to handle large loads so that you don't injure yourself, which is exactly what happened to me. I picked up a very heavy suitcase in an airport and I collapsed. So it makes perfect sense. But on top of that, once you're in that situation, I think what you really need to do is get multidimensional care. So I think everyone here comes from a different background, and we've talked about that. And this is what we teach at the University of Toronto in our pain center. We really believe in a multidimensional approach to pain care because no single facet will treat pain. Pain is, like Dr. Rod said, a multidimensional problem, and Haley said, it's a multidimensional problem with emotional, affective, and sensory components. And so we need to treat each of those aspects to be able to make sure that people are functional again.
So how do you know the difference? I mean, lower back pain, everybody of a certain age has a little bit of lower back pain. You know, possibly you should just live with it, but how should people know when it's something that they really need to get help with?
Well, it all comes to being properly assessed about the condition and knowing what exactly the diagnosis is. But it's important that I also know that having the lower back pain is not a sentence for life. There's always hope. Once we have the evaluation of what the condition is, there are always solutions related to level of activity that we can do safely, medication that we can take, and if there are other biopsychosocial elements that are causing the pain or contributing, we have to address those.
So is there a solution other than surgery for the herniated disc?
Absolutely, yeah. You know, there's always this balance between the element of our health and also the elements that want to cause diseases for us. By improving the health, the general health of the person, that we call salutogenesis instead of pathogenesis, focusing on our health, we can improve our whole strength of the body, improve our nutrition, include our mind-body medicine. Basically is the new approach that we use in order to strengthen the level of health so the diseases would back off.
You've been nodding.
Yeah, because you asked about what the treatment for disc herniation is. The vast majority of disc herniations, when they're pressing on the nerve root and people have that pain down the leg, they'll resorb. The people will heal, right? What the body does, it comes and eats up that tissue. But it's horrible why it's happening, because it's like having a cut on your finger and you put vinegar on it, right? It's a tiny little bit of damage, but you have this inflammatory process and it hurts so much. But that inflammation that's occurring, that's your body healing itself and resorbing. So you have a terrible 6 weeks to 3 months of pain for the vast majority of people, and then we'll just slowly go away. So what we focus on is what the doc said, was that we want to make you as happy and as healthy as you can while you cope with that situation going on there. So most people will be fine on their own. And then there's a small subset where you consider seeing the surgeon, and then with the case that you saw there, she wasn't a candidate for that, which is fantastic.
And do you prescribe exercise for that?
So you'll give it a try at the start. You're always looking for things that feel good and things that don't feel good. So I'm a genius, and if it doesn't feel good, I say don't do it, because I'm an advanced care practitioner, I guess. And so what we're doing there, you can sometimes find relieving positions, and you just do as much of that, right? And then slow over time. And some people you'll find a relieving position, and that's all that they need. They do as much of that as they can, and they can have a dramatic shift. Other people, it's understanding they're safe, this sucks, but I'm gonna get through it. That's this idea of making sense of the pain. And then they have some hope and confidence, and then one day they're like, oh, my back is suddenly hurting less.
That's where you come in.
Oh, exactly. So in practice, we work with other professionals very closely, like physio, because what Greg talked about a lot, that's what we recommend patients do as well, right, to not trigger the pain, right? But other than that, a lot of people may feel like their life is becoming very limiting when they are suffering from pain, and they may become very irritable in their daily lives. Like they may have more arguments with their family members or friends, and that's the part, for example, that we can jump in to help them better cope while they are doing other interventions for alleviating their pain.
And is there a thing where if you anticipate pain, like you tense up and then it's going to hurt more, right?
Yeah, absolutely. Expectation and priming. And this is this idea that you have something in the tissue happening, but we can amplify those signals throughout the nervous system. So expectations and what people believe about their problem can really modify not just their beliefs about the pain, but it can change your physiology.
Yeah, and in palliative care, we talk a lot about this concept of total pain, which is pain is more than just the physiology. It's more than just the tissue damage. Past experience with pain, anxiety, other stressors can all change the way pain feels and the way we express ourselves when we have pain.
What about deep breathing for pain?
I think meditation and deep breathing can absolutely be a resource, although I'm not an expert at that.
There's phenomenal research out of San Diego where Fadil Zaidan's done these studies where he's basically used meditation for low back pain patients, and he finds that it actually dramatically reduces their pain. And this goes back to that mind-body connection, right? So the idea of this whole process of meditation is learning to listen to the signals of your body and not amplifying them and not worrying about them and really putting that worry out of mind. There's a lot of evidence showing that the context and the worry of the pain are what can amplify it. And if you can reduce that worry, you actually are much more able to cope.
Okay, we are taking a short break. When we come back, we'll discuss how mental healing is just as important as physical. That's next.